Okay, well, welcome everybody. Just want to quickly introduce ourselves. My name's Alex and this is Katja, and we'll get into our bios a little bit. But today we're going to be talking to you a little bit about neurological rehabilitation, just kind of looking at the differences between sort of general physiotherapy and how it might differ from the neurological approach to physiotherapy.
Okay, hi everyone, I am Katja. I decided to include a photo of myself with my dog because he's an important part of my life. I am a registered physiotherapist. I graduated from the University of Toronto with my bachelor's in kinesiology in 2013, and then decided to go on to do my master's of physio from Oxford Brookes University in England. I also, aside from working with the neuro population, I specialize in pelvic floor physiotherapy as well. And if anyone has any questions on what that is, I can kind of explain it at the end. And yeah, I kind of just like outside of work. I like to hang out with my dog, clearly. I like to stay active, reading, spending time with friends and family as well.
And I'm Alex. Unlike Katja, I don't have a dog, but I am a physiotherapist. Kat and I have spent way too much time together. We did our masters together. So we lived in England together for a while, and we both work up here in Bergin at a clinic. My special interest in physio is the neuro population. So I spend a lot of time working with TBIs, so working with brain injuries and working with spinal cord injuries and stroke populations. Those are sort of my favorite groups of people to work with. Since I don't have a dog, I spend a lot of time playing sports and watching sports, and I'm a big coffee fan.
He's drinking coffee right now.
Of course, so there's always a coffee on the go.
Okay.
And today we'll do our best when we're going over things, we'll make sure that there's time for questions at the end. So if there's anything we talk about that you're unsure of, or if you want more information, we're definitely going to make sure there's time for questions at the end.
Yeah. Okay. All right. So like Alex said, we're going to today talk about neurophysiotherapy and what it is, who it benefits, and how it can help you or somebody that you know. Do you want to go through this? Okay. So kind of talking about just areas of physiotherapy. So everyone that goes through physio school kind of learns the same things. So everyone graduates physio school with the same sort of skills. And then after graduating, a lot of physios specialize in different areas. So some might go into sports injuries, some might go into, like I was talking about before, pelvic floor physiotherapy. And we've sort of listed off a few different types of physio here. So like I said, we have orthopedics, which is kind of the most commonly known type of physio, where people get like an ankle sprain and we'll go see a physio to help rehab it. And then you get neurology or neurophysio, which is helping people with, and we'll go through lots of different areas today, but whether it's brain injuries or spinal cord injuries, and then vestibular, we have sports, pediatrics, which is working with children, geriatrics, which is working with the older population, cardiorespiratory, which is working with people who have maybe breathing difficulties, and then, like I already mentioned, pelvic floor. And we'll touch a bit on this today too, but a lot of these areas overlap. So sometimes people who say have a brain injury might be dealing with something that somebody who has an orthopedic injury is also dealing with. So there tends to be tons of overlap in all of the different areas.
And since it's probable that most of you have been through some sort of physio or been to a physio before or have heard about physio, you might know a little bit about it, but we'll try and share some of the differences here between sort of the ortho physio, or we're going to refer to them as general physios. I know that might seem maybe not a perfect description, but it's an easy way to think about it. So with a general physio, it's sort of the most widely known type of physios. Some of their different treatments, they use different modalities. So you might have heard of ultrasound or different TENS machines or things to help with pain. They also might do exercises with you, or soft tissue massage, or different stretching techniques. And they're focusing a lot on sort of more sprains and strains, fractures. So some more sport-related injuries or postural imbalances. They deal with different pain conditions, arthritis, but really there are a lot of different injuries and conditions that they work with. And we'll try and explain how it's a little bit different than maybe seeing a physio that works more with neuro conditions.
All right, so now we're going to kind of get into what conditions are treated by neurophysiotherapists versus, again, kind of the orthopedic or general physiotherapist. So you may have heard of some of these, may have heard of all of them, but some of the common types of injuries or conditions that are treated by neurophysios are either acquired or traumatic brain injuries, strokes, and there's a few different types of strokes as well, spinal cord injuries, and that could be at any level of the spinal cord, multiple sclerosis, Parkinson's disease, cerebral palsy, muscular dystrophy, and there's, I mean, we could go on. We didn't want to list them all, but there's tons of different other kinds of neurological conditions, but these are sort of some of the really, really common ones that we see in clinic. And then a lot of times people who get treated for these conditions could have been very recent that they were either diagnosed, or it could be kind of a long-standing diagnosis as well.
So right now, Kat and I both treat pretty much every single one of these conditions here in the clinic. So we have sort of a wide range of treating different neurological conditions, but this is not obviously a full list of different things that can be treated by a neurophysio, but it's just a sort of sample.
There we go.
So recognizing we're talking to a few people who maybe suffered an ABI, a different brain injury, these are some of the symptoms that you may have experienced, maybe not, and everybody's a little bit different. So some of the things that are common after a brain injury can be headaches and dizziness, some balance issues, some difficulties with walking, some difficulties recognizing one side of your body, sometimes called hemi-neglect. You may have heard that term. Maybe some changes in sensation, either things are feeling really sensitive or having a hard time feeling them. Sometimes muscles get really tight or they can be spastic. We've heard that term before. Fatigue and deconditioning can be common. We might get some weakness in some of our muscles and maybe some difficulties with different movements. Again, you might experience some of these, you might experience none of these, or maybe you have experienced all of them, and that might change from time to time. But these are just some of the common symptoms that we sort of work with some of our clients.
Sorry, 1 second. There we go. Okay, so we're going to kind of get into why Neurophysio works, and we I can't remember if we mentioned this already, but we're going to be focusing mainly today on sort of discussing brain injuries. But again, that list that we talked about before about different neurological conditions, a lot of the stuff that we're talking about can translate into those conditions as well. So it's all very interchangeable. But why it works is our brains and our nerves are changeable, or some of you may have heard the term neuroplasticity. That is just a term that basically describes our brains have the ability to adapt and to change and to learn new movement patterns or relearn movement patterns. And so if you're experiencing, say, some weakness in a muscle and some of the nerves were maybe either damaged or they aren't getting the signals to them as well anymore, those nerves can kind of grow new pathways. They can relearn how to activate the muscles, which is pretty cool. And this can kind of happen at any point in time. So regardless of how let's talk about ABIs for a second. So brain injuries, whether your brain injury was 30 years ago or if it was yesterday, right? Progress can be made at any point in time, regardless of how far along you are. And physios can kind of help guide clients to rediscover those movement patterns, or even develop strategies on how to change the way they're moving and change in a different way, so that way they can kind of get the same result in the goal.
I think that's a really important point that Kat's making about how the progress can sort of happen at any point in your recovery. There's no sort of timeline in terms of, oh, there's no more progress that can be made here. With neurophysio, we can start working on things right away, or sometimes it takes a little bit down the road to make different progress. Yeah.
Oh, sorry.
I can go through this. So we want to just review some of the areas of physical function that we might work on in neurophysio sessions. This is not going to be everything we work on, but this is some of the things that we're commonly addressing in a session. Again, every person is different, but this is some of the things that we regularly work on with people. Posture. I'm sure everybody just fixed their posture a little bit when they saw that picture of the cat. Said, "Oh, I don't want to be sitting like this." So in our physio sessions, we always look at how someone's posture is and what changes can be made. With poor posture, we might get some increase in pain. It's important to make modifications to our posture to help with our muscle imbalances. So making sure we're similar on one side to the other. Improving our posture can help with our mobility, and we'll talk about that a little bit more after. And the reality is everyone can kind of improve their posture. It doesn't really matter what kind of injury or condition that they have. There can always be improvements to their posture, and sometimes it just takes maybe a conversation or a session or two with a physio to talk about what changes can be made and what types of things should be addressed. So that's something we work on regularly with our clients.
All right, so kind of Alex already just sort of mentioned this in the last slide, but our mobility is a big factor in our physio sessions, and especially with brain injuries or ABIs, we often have limitations in our mobility after, and that can be anywhere from neck, back, shoulders, elbows, hands, knees, ankles, feet. So basically the entire body, and it depends on where the brain injury is affecting the body. And it could be one side versus another. It could be both sides. And so mobility is really important to be able to move properly, right? So it's a fancy word for talking about movement. So to be able to bend, to stretch, to squat, to pick something up off the floor, to reach into your cupboard to get a cup out of the cupboard, you need to have proper mobility in your joints and your muscles. So it's essential for performing those activities of daily living. So we want to make sure that that's a kind of key area that we focus on in our sessions to regain those movement patterns and to be able to do what you want to do, right? To reach your goals.
And this is maybe not a perfect picture because we don't always just have our clients laying on their back looking like they're relaxing. A lot of mobility is active and we're working on movement. So it's not like this lady who's lying here and looks quite relaxed and is enjoying a nice sort of stretch there. A lot of time in our sessions, people are moving with us and we're getting them in different positions. Maybe we're sitting on balls or rolling on the ground or different things. So mobility isn't quite as maybe relaxing as it looks there all the time anyways.
Pictures can be deceiving.
So gait is something that if you've been to physio before, following your injury or elsewhere, that maybe it's something you've worked on. We see a few pictures here of all these people trying different techniques to try and improve their walking patterns. So often after an ABI, walking and movement can be impacted. Maybe you don't get around quite the same as you did before. And when we refer to gait or movement, that can be anything from maybe you're in a wheelchair now to you're walking with a cane or trekking poles, or sometimes you're not using anything, but you feel you're not walking maybe the same as you were before. In physio, sometimes treatment can work to improve your abilities by assisting the way you move or walk. Sometimes our brain and our body need to learn how to walk. We need to feel those movements again. Sometimes it's about just getting a little bit stronger. So in physio, it's looking at going through some exercises to get a little bit stronger in maybe our legs. Sometimes it requires a little bit of core strengthening. Sometimes we work through exercises to regain standing balance. So just being upright again can be a challenge and something we work on. I mean, we also work on people getting better at even sitting. Sometimes sitting is not an easy thing to use those core muscles again. So we use a bunch of different devices to try and reteach people how to walk or to move again. So sometimes we use parallel bars. So those bars pictured on the left side there. Or we might use different gait aids like the trekking poles in that top picture, or maybe canes. Sometimes they can be helpful. And sometimes there's other tools we use like body support treadmills. So they can help sort of offload your body to make your body not feel as heavy, to help relearn how to walk again. So there's lots of components to gait, but gait is something that we work on pretty regularly in physio with a lot of our clients, most of our clients really.
Yeah, it's a common thing we work on. All right, so again, sort of touched on already too with the gait training, but balance is a huge component, especially after ABIs. And again, it could be sitting balance, it could be standing balance, walking balance, right? Those all change in different positions. So we work on both in a variety of different ways. So you can see in the photo, that's obviously quite an advanced balance movement, right? Standing on a bit of a pad to lift a foot. It doesn't necessarily have to be that complex. It can be holding a ball and sitting, or even lifting your hands up and sitting, depending, depending on what your weaknesses are and what area of your body's been impacted. And yeah, it's a way that we incorporate some strengthening as well, right? So balance and strength kind of go hand in hand as well. So they all sort of intermix in with each other.
Just on the note, it's interesting with balance. Like this is a picture of Katja and myself, and Kat's working on her balance. And I think we had to take this picture pretty quickly because I don't think Kat could hold that pose for very long. No. So it was a pretty get the shot and move on.
So pictures again can be deceiving. So it's my balance is sometimes not great. So I should probably work on it a little bit more.
So another component that we work on in physio, and this is something that maybe might come to mind, is we're working on a lot of different strength training and endurance training exercises. So this is where there's a little bit of overlap between some neurophysio and sort of more of the general orthophysios. And when you think about physiotherapy, you think about a lot of doing exercises. So sometimes in our neurophysio sessions, we're doing strength training using body weights. So sometimes we're just working on some squats or working on just different bends or muscle strengthening. Sometimes we're using cables, dumbbells. And sometimes we're trying to work on our cardiovascular capabilities. A lot of times after an injury, we don't have the same ability to resist fatigue as we did before. So we get more tired more easily. So we do a lot of work to try and improve our clients' ability to resist fatigue or endurance. So we'll have our clients regularly on stationary bikes or treadmills, ellipticals, rowing machines, ski ergometers, hand cranks, and you might be familiar with all of those or none of those, and we're happy to answer questions on what those might be. And it's about finding the right cardio tool that works for you. And one of the things is not all ortho clinics or general physio clinics will have access to most of these. So it is really important if you are going to a physio to make sure that physio has the machines or equipment that is helpful for you.
Yeah, and we always kind of figure out too, depending on, again, like we've already said, every brain injury is very different. So sometimes people really struggle with walking, so treadmill might not be for them, right? So we figure out exactly what machine and what use of equipment is going to be appropriate for that client. All right, so now after talking about a bit of that stuff, we're going to talk about how long general physio appointments are. I shouldn't say general, so more neurophysio appointments. They're approximately about 45 minutes to an hour and a half long. It very much depends on what is needed in the session and the needs of the client. that might seem like a long time to some of you. It might seem pretty normal if you've been to physio before, but it is a bit different than if we talk about kind of that general ortho physiotherapy appointments, which tend to be, depending on the clinic, 20 to 30 minutes, which is a big difference in time. So you might kind of ask why that is. Neurophysio sessions tend to be a bit longer because of the complexity of the injuries. And there usually is multiple components of the body that need to be addressed. So we kind of already talked about the different components that might need to be looked at, whether it's balance, your strength, your mobility, your gait. So we just need enough time to be able to do all of those things, right? So, and sometimes moving from one piece of equipment to another piece of equipment takes a little bit longer. So you just need to accommodate for that time. And so that's why those sessions have to be a bit longer than ortho sessions. Okay.
So one of the things that we thought it would be important to talk about are physio sessions. Kind of seems like maybe a scary thing if you've never been there before. So we wanted to talk a little bit about some of the things that maybe you're thinking about. Oh, I don't know how I feel about physio. I don't know how I feel about going there. Maybe some different concerns, and talk about how we typically overcome them at our clinic, or some other neuro clinics typically have the same sort of setup. So one of the things about going to physio, it can be scary, it can be anxious, you can have some fear about it. So what we say here is support workers and family members are always welcome to come join your sessions, whether it's for just the first time or every time. Maybe you need some help getting there, or you just would like to have someone there with you. We're always comfortable with that. I think it's sometimes helpful. Or if you prefer to come alone, we're also okay with that. One of the important things there is to find a physio that is approachable and you're comfortable with. And that won't be a perfect fit for everyone, but to find a physio that works for you is really, really important. One of the other things we find with some of the barriers is that people avoiding physio, they're worried, what if I get too tired? In our physio sessions, we always make sure that there's time for breaks and rests, or we change things so that you don't get too tired. And we always make sure that we're not starting in a very challenging level. We're starting in what's appropriate for you. So things are getting progressive. So they're slowly becoming a little bit more challenging without it being too much off the start. So we try and make sure that that's well managed. And then the other thing that people have mentioned is dizziness and headaches can sometimes be a problem. So in our sessions, sometimes we work on manual treatments to try and help with some of the headaches. That could be some work on the neck or different stretching programs. And we really do our best to make sure that we aren't provoking those headaches by making things too hard, but making them appropriate so that things can slowly progress. Another component that people are worried about with physio is saying, oh, I know if I go out for too long or I'm nervous that my mood might change. Here at our clinic and at most clinics, we try and keep it as fun and light as possible, and it shouldn't be a scary setup. Again, we're there to improve, but we can still have it an enjoyable, fun, playing different games to make sure that it's not a daunting or scary experience. Other issues is actually physically getting to the clinic. So some clinics are hard to get to, but a lot of times there's different transit options. So whether we're taking Wheel-Trans or Uber or taxi, a lot of different neuro clinics will help organize that for you, and can help with different scheduling and things like that. And the actual setup of the clinic can be challenging. The accessibility. So most neuro clinics are pretty accessible. I know our space has a pretty open concept, so there's lots of room to move around if you have a wheelchair, or easy to get into the door. There's different ramps, because I know Katja will speak a little bit more about this, but other clinics that she's been at before maybe don't have as much space.
Mm-hmm. Yeah, a clinic I used to work at a couple of years ago, sometimes we would get someone call and say that they were in a wheelchair, and I was at the time not seeing as many neuro clients, but they would say that they were in a wheelchair, and we would have to turn them away and send them to a different clinic because it was in Toronto. There was a little bit less space, and we couldn't accommodate wheelchairs because there just wasn't enough room for them, and the doors weren't wide enough for them. So you always just want to make sure that if you do use some type of either walking aid or wheelchair, that you do ask the clinic before you go to make sure that they are accessible. But if you if they are seeing neuro populations at the clinic, then most of the time, everyone that we kind of know of is fully accessible. So, and always make sure too that they have an accessible bathroom as well.
The other part that I just wanted to mention there that I just skipped over is sometimes getting to and from clinic just doesn't work. Some neurophysios, some general physios also offer this, is they offer some in-home treatments. So that's sometimes an option. It's not for everybody, and sometimes there's limitations in the home, but it is something that can be done if getting to a clinic is too challenging.
Mm-hmm. Yeah, Alex and I each have probably 3 or 4 clients that we see in their house. So like you said, we just have to make sure that the home environment is appropriate for physio in terms of space. But most of the time we can make any space work. We get creative with it. All right, so just to kind of touch on some of the important points that we mentioned to keep in mind. So with all neurophysio sessions, so each session is always goal-oriented and individualized. So what works for one person doesn't work for the next person. So, and every brain injury or every kind of condition is different. Everyone has different goals, whether it's, I want to garden, I want to cook, I want to, whatever you kind of want to do, your session is often geared towards strengthening the muscles and increasing the mobility and increasing balance to get to those goals. Whether it's a short-term or a long-term goal, we can kind of start setting those when you first come in during your assessment. And goals can always change as well. And then sessions will change with them. And yeah, working towards something that you enjoy. So I mean, I've already sort of mentioned this a little bit, but no condition, no brain injury is the same. They are all very different. I have never met one that is the same as the other. So all the treatments are different and individualized. Physio sessions are very active. And again, we don't want to deter you from anything, but they are hard work because with hard work comes change and comes good things, right? So we want to make sure that we're challenging you in an appropriate manner at your level, but that way we progress forward with things. And yeah, all sessions are just aimed at getting you back to doing what you like to do. So that goes back to keeping things individualized.
Yeah, I know Kat and I both really focus on when we meet somebody for the first time, we ask them, what is your goal? What do you want to get back to doing? And that's where we gear our treatment as much as possible to getting you back to whether it's gardening or cooking or whatever that may be, and just improving towards that.
Okay.
Okay, so just a few sort of takeaway messages before we open up to some questions. Here's a big question: is physiotherapy for me? And that's a big question. But the reality is, if anything that we've sort of touched on is challenging for you, whether it's mobility or gait or strength or sensation or anything we really talked about, if that fits in with some of your issues, then it's a possibility that physio might be for you. It might be the right time, it might not be the right time, but to find a physio that is right for you, it's important to talk to them about what types of clients and what types of conditions they treat. There are some physios who say, oh, I only treat clients with knee issues, and they're a specialist in that field. But it's really important that if you're booking a physio appointment, that you find out what types of conditions that physio treats. Do they treat neural populations? Do they spend time treating clients with brain injuries? The other thing is, it's important if you're looking into physio to ask about the accessibility of a facility. Can I actually get in there? Is it going to be easy to get into? What's the setup? Is there a ramp? Can I walk up there? What's the setup? And another take-home message is, hopefully we haven't scared you away from physio by talking about how hard the work can be, but physio can be fun. It's I know most of my clients, they like coming in. It's enjoyable. It's part of the highlight of their day. I know it's nice to see progress, but we want to make it an enjoyable time too. And I know Kat talked about this a little bit, but physio can be helpful regardless of how far you are. Don't think you're okay. I'm 10 years since my injury, I can't make any more progress in physio. We get lots of clients that come in years after their injury and say, I'm ready now. Let's work on some stuff. But again, I think it's really, really important to find the clinic and the physio that works for you. it's not a one size fits all. Some clients might do better with Kat, some might do better with me, some might do better with neither one of us. So it is really important that you find the facility and the physio that works for you if that's something that you're looking into. Yeah, any other sort of take home messages you want us to talk about, Kat?
No, I think we covered everything. And yeah, and you can get a pretty good, I think something you might be kind of asking, how do I find a physio that's right for me? I think the first step is first calling the clinic and asking those questions about accessibility and what types of clients that the physio treats. Because like I said, I did work for a little bit of time in a clinic where wheelchairs weren't really accessible, right? And if you happen to use a wheelchair or you know someone who uses a wheelchair, that clinic's probably not for them. And so you always want to ask those questions, and then asking to talk to the physio, so that way you can get a bit of a sort of an idea of what they're like, get a bit of the vibe of the clinic, and then you can go from there. So you can get a pretty good idea of what they're like over the phone. So rather than having to come all the way in on your first session, and that can just be down to like a 5-minute phone call. All right, so we're going to kind of open things up for questions, comments. We're going to leave our contact information here. So that's both of our emails, the clinic that we're at, and the phone number in case anyone is needing it. It's all there for you. So you can either write that down, take a screenshot, and then we'll get to some questions. So